Okay, good morning. So this is going to be fun. We're going to talk a little bit about how you translate some of these principles of equity. Let me get rid of that first. Oh, I can't. Let's see if I can blank it. Into a practice, which is, for me, the most fun thing to do. It's the actual operationalization of these ideas into kind of a working set of experiments on the ground. And that's what building healthy communities is. It's kind of a great job. So in short, I was hired to, with a number of other people, to take basically $1 billion over 10 years in 14 low-income communities across California and try to measurably improve health status over that 10-year period, with one big caveat, and that is that we can't spend a nickel on health care. So it's really an attempt to design a strategy to invest in the so-called social determinants of health and health equity to try to produce measurable results. And we are the people who wrote it up on paper. These are two of the people who are actually translating these wild notions into a practice. And so the wonderful thing about doing a panel like this is that you get an opportunity to hear your crazy ideas described from the ground and all of the checks and accountability that that entails. But I want to start by reminding us that we really can't talk about health equity unless we know how we got to where we are. And this is one of the challenges for me in this work, is that typically we throw terms around like equity and disparity and various other terms, structural racism, and we talk about them as if they sort of began today. And we don't look at the legacy that we're having to contend with in these communities. I mean, these communities didn't arise spontaneously, they were created. And until we understand the forces that created them and the ideologies that created them, it's very hard to undo them. So let me take you through a little bit, at least, of my thinking on this subject. I like to start with this quote, and I'm just going to read it to you. I know a number of you know who said it, but I will pretend that you don't. I will say then that I am not, nor ever have been, in favor of bringing about in any way the social and political equality of the white and black races. That I am not, nor ever have been, in favor of making voters or jurors of Negroes, nor of qualifying them to hold office, nor to intermarry with white people. And I will say in addition to this that there is a physical difference between the white and black races, which I believe will forever forbid the two races living together on terms of social and political equality. And inasmuch as they cannot so live, while they do remain together, there must be the position of superior and inferior. And I, as much as any other man, am in favor of having the superior position assigned to the white race. And that was Abraham Lincoln, the great emancipator. And, you know, all of us have been to the Washington Mall, and we've all been to the Lincoln Memorial, and we've seen the great words of Lincoln carved into what I assume is marble on the walls of the Lincoln Memorial, but we don't see these words. And we have to ask ourselves, why not? And he said this in a public debate. This was his position, and it was intentional. This is the U.S. Supreme Court in the Dred Scott case. In the opinion of the court, the language used in the Declaration of Independence show that neither the class of persons who had been imported as slaves, nor their descendants, whether they had become free or not, were then acknowledged as part of the people, nor intended to be included in the general words used in that memorable instrument. They had for more than a century before been regarded as beings of an inferior order, and altogether unfit to associate with the white race, either in social or political relations, and so far inferior that they had no rights which the white man was bound to respect, and that the Negro might justly and lawfully be reduced to slavery for his benefit. And then not that much later, this gentleman, may he rest, there are those who contend that it does not benefit African Americans to get them into the University of Texas, where they do not do well, as opposed to having them go to a less advanced school, a slower track school, where they do well. And of course, can't leave you without the famous third stanza of our national anthem. Where band who so vauntingly swore that the havoc of war and the battle's confusion. Is this still working? Hello? Oh, no, it fell off. Let me grab the other thing. Table mess here. Thank you. And where is that band who so vauntingly swore that the havoc of war and the battle's confusion, a home and a country should leave us no more? Their blood has washed out their foul footsteps' pollution. No refuge could save the hireling and slave from the terror of flight or the gloom of the grave. And the star-spangled banner in triumph doth wave over the land of the free and the home of the brave. So this is ostensibly what we put our hands over our hearts and sing at football games. So, I show you this intentionally to, not just to provoke you, because I love being a provocateur, but also to get us to think about legacies and how we got where we are today. Because if we don't understand that, we can't undo that. So one of my big challenges is looking at frameworks. When I first got into this work, I wanted to find some way to explain what I was seeing in front of me in communities. And so I looked at a bunch of socio-ecological frameworks. And my challenge with these frameworks is that they don't go far enough. They never talk about the drivers of inequity. And the furthest afield from the individual factors is typically this sort of loose description of a constellation of social factors that is poorly described. In this particular one, you talk about societal and policy factors. Societal and policy factors. I don't know what that is. Here's another one which talks about regulations, government, public policy, laws, media, food industry. So, racism? Where's that? This comes from the CDC Health Equity Toolkit. And the furthest afield is federal, state, and local regulations, laws, the built environment, public works, infrastructure, etc. Again, I don't know what that means. Where does all of that come from? We have to understand where that comes from in order to get underneath it. So, and this is an honest question. This is really, it's a conversation we ought to be having. How do we think about these things? How do we pull these things apart to be able to design a practice that gets at that legacy? Okay, this one I actually kind of like. This is National Academy of Medicine. It gets a little bit further. It talks about broad social, economic, cultural, health, and environmental conditions and policies at the school, national, state, and local levels. And in sort of the asterisks associated with that, it actually does talk about race, not racism, which is oftentimes, I think, a problem when we talk about race and not racism. We're afraid to talk about isms. We're just afraid, particularly in academic circles. We're afraid to talk about it. And I put it to you, you cannot do this work. And you will not be taken seriously by your partners in the community if you don't talk about racism, if you don't talk about classism, if you don't talk about sexism, and talk about strategies to develop a practice that's anti-racist, that gets underneath these things and begins to reverse them. And that, hopefully, we can talk about a little bit of that today. This is another one that talks about socioeconomic and political context, governance, policy, macroeconomic, social, health, cultural, and societal norms and values. Talks about values, at least, but we need to get underneath those. So this is what we designed at the Bay Area Regional Health Inequities Initiative, which was 9 frustrated local public health practitioners who realized that the tools we had at our disposal were not up to the challenges that we were facing, so we had to develop our own tools. And one of the tools we developed is this thing called the Bar-High framework, which is a very simple, now note it's a framework, it's not a model, it doesn't try to explain how all of these things interact. It just tries to pull apart the spectrum of opportunity for intervention and allow us to see where there may be meaningful opportunities to intervene. So it recognizes that the traditional medical model talks about individual behavior producing disease, which produces premature mortality. And then the medical model offers essentially health education, clinical care, and quite frankly, emergency rooms to try to contend with these challenges. And that's a $3 trillion enterprise. simply put, and it's all necessary. But we recognized to get upstream, we had to figure out not only sort of these loose, generic terms to describe what was happening, we actually had to figure out what we could intervene on. And so that's how the Barhai framework came about. And what we recognized is that when you see social vulnerability manifest in a community, in other words, a whole host of people that are exposed to the same kinds of risks, community level risks, and they're socially vulnerable, which means that anything can tip them over the edge. It can be a foreclosure crisis, it can be HIV/AIDS, it can be a hurricane. We have created social vulnerability in a group of people and situated them geographically in close proximity to one another. What causes that? We think that that's driven by a weak social compact, a set of policies and practices that doesn't anticipate inevitable human needs. In fact, actually steers resources away from people that are deemed to be less deserving of the full benefits of society. And what drives that weak social compact? We think that ultimately it's an exclusionary narrative. And that exclusionary narrative is a narrative, it's a way of thinking about who we are as Americans and who matters. And this is a much easier conversation to have today, post-election, than it would have been a year ago, because one of the candidates was a beautiful illustration of an exclusionary narrative. And an exclusionary narrative depends on targeting a population that is deemed to be unworthy, and then dehumanizing that population. That population is somehow not quite human. And the exclusionary narrative also argues that we are in a zero-sum competition, that there is scarcity. And if those others get what we need, we will suffer. So we need to be able to exclude them from fair competition for those resources. And the exclusionary narrative also, despite what I showed you about the narrative of this country, argues for this glorious, rosy, nostalgic past that we need to get back to, and presents the future with fear and anxiety. And so if you want to undo this, you have to undo this narrative. You have to undo and create, reweave a social compact that makes sense. And that you have to create, instead of social vulnerability, you have to create real social, political, and economic power in a critical mass of people living in these communities. And that's what Building Healthy Communities is an experiment on. It's trying to do these things, undo a lot of these things, by creating a powerful, inclusive narrative, by reweaving our social compact, and we have lots of evidence, we can talk about that, and create, instead of social vulnerability, social, political, and economic power. And these colleagues of mine, one unfortunately wasn't able to make it today because she is ill, will hopefully be able to describe to you what that looks like on the ground. So I'm going to turn to them now. First, I need my piece of paper. Okay, so who are we going first with? Are we going first with Andrea? Okay, well, we'll just guess.
Okay, I can go if I'm on the left, I guess.
Okay, well, let me give you a quick introduction, and I'm going to sit down here and do that. Take this. So, Andrea Manto is the hub manager in East Salinas. We have 14 communities, of which East Salinas is one. It's Andrea will describe it for us. And she has been at the heart of this practice that we are learning enormous amounts about, called Governing for Racial Equity. And I'm going to let Andrea just go ahead with that. Her bio is in the packets that you have, as is all of ours.
Thank you.